been any recent developments in how DLBCL is treated?
There have been recent developments. So the CAR T cell therapy, there's now 3 approved options for patients. And so even patients who maybe were older and not considered candidates for a stem cell transplant because of other medical factors might be able to get the CAR T cell therapy. This is now again approved in the second line. There's a couple antibody drug conjugates, the polatuzumab and loncastuximab. They target proteins called CD79 and CD19. And the polatuzumab is the one that probably is going to be available for part of the frontline treatment in the future. There's the antibody tafasitamab and lenalidomide. These are all approved therapies in the relapse setting. There is also therapies that are being studied and showing promising activity, which we think are probably likely to be approved in the future. There's something particularly called bispecific antibodies. So this targets a protein on the tumor cell, but also a protein on the T cell. So remember, I said your T cells aren't functioning. So this targets the protein on the lymphoma cell, but then targets a protein on the T cell to engage it to attack the lymphoma cell.
Right. Combination approaches?
Yeah, so there are a number of combination approaches under study. A lot of the therapies that I mentioned, like the bispecific antibodies, the antibody drug conjugates, these are all therapies that, they have side effects. I hate to say they're well tolerated. They have side effects, but their side effects are such that they can be combined with other agents that have different toxicities or combined with each other. And so there's a lot of ongoing trials looking at combining these. There's also oral targeted therapies that target proteins that are known to help the lymphoma cell survive. And these are immunomodulator therapies, BTK inhibitors, other inhibitors that are being evaluated and used in combinations.
Thanks, Dr. Maddocks. That's really helpful information.